to them or point them in the right direction. We'll talk about language assistance, because I think that will be an important factor, and we'll talk about why. We'll summarize the application process. Then I'll come out of the application and move over to Shop and Compare tool, and we'll talk about that. And then lastly, I'll leave you with the multiple ways that people can access Covered California. Next slide. I just want to begin with reminding everyone that this is an atypical enrollment season. People can enroll in Covered California all the way through March 31st without being subject to the penalty. After this year, it'll be the normal October to December enrollment, but this year at least, they have until March 31st. Also, I just want to make it clear that if a person has a major life-altering event, get married, get divorced, have children, lose job, change job, then they may be eligible to sign up even outside of this enrollment period without any penalty. Next slide. We're going to start with just a little overview of Covered California before we actually delve into the website, and that's what we'll do first. Next. So here, this is just to remind you, as of the 1st, most people in the state of California are required to have health insurance, or they will be subject to a financial penalty at the time that they file their taxes. Those of us, or those of your patients who have children for whom they put on their tax return, if they do not sign their children up, they will also be liable for a penalty for not signing up their children. Next. The ACA expands Medi-Cal, as you know. Now, if you're 138% of poverty, you most likely qualify for Medi-Cal, and you don't have to be, as in the past, either disabled, over 65, pregnant, or with the children. None of those requirements are left. You only have to be 138% of poverty. And just to give you a little information around this, as of January 21st's press release from Covered California, 584,000 newly eligible people have been signed up for Medi-Cal, and 630 people who were on LIP sort of programs, county programs, have been moved from those programs to expanded Medi-Cal. Most of those people who are moved from LIP programs to expanded Medi-Cal will be enrolled in Medi-Cal managed care programs. The ACA definitely streamlines this process, although a person may not realize when they go in the portal and apply, the system automatically looks first to see if they qualify for Medi-Cal. And if they do, they're alerted to that and sent in that direction. If they do not qualify for Medi-Cal very seamlessly, it moves them over to the Covered California and sees if they qualify for premium or point of service reductions, and then gives them choices as to which plans they may want to apply for. And that's why it's no wrong door approach. You go into one portal. It very seamlessly gives you an idea of what you qualify for and don't qualify for. Instead of in the old days, go one place to apply for Medi-Cal and find out if you're accepted or not, go to a different place to look at all the different health plans. Here, it's all on one portal to make it very easy for the person to figure out what they actually qualify for. Next. Here we say that there's approximately 5.3 million uninsured Californians. I want to actually say there's about 5.3 uninsured people who qualify for getting insurance through the exchange. About 2.4 million of those will qualify for subsidy. About 2.3 million of those will not qualify for subsidy. There's an additional 1.4 million who actually will qualify for the Medi-Cal expansion because they are 138% or below of poverty. The next two bullets talk about if you are above or below 400% of poverty. If you're below 400% of poverty, you can buy through the exchange and get a premium assistance and or cost sharing reduction. If you're over 400% of poverty, and this is very important that people realize, you can still buy through the exchange, you just will not qualify for subsidy. Having said that, depending on what area in the state a person lives in, buying a very comparable plan in the exchange versus outside the exchange still within itself may lead to cost savings for the individual, even if they don't get premium assistance. So I strongly encourage people who are over 400% of poverty to still at least look at the exchange when thinking about insurance. Next. This next slide gives us an idea of the target populations in California who qualify for Covered California. As you can see, 46% of the people who qualify are Latino. Unfortunately, we are under producing and signing up Latinos so far. Of that 46% who qualify, only 20% of those who have signed up are Latino. And you may have heard in the news, and if you've looked on the website, we've doubled our efforts to try and encourage people from Spanish-speaking backgrounds to sign up because, at least at this point, we have underperformed in this area. Next slide. This slide is just to give you some understanding of where the people who qualify for Covered California actually live. And as you can see, it is not evenly distributed throughout the state. I'm up in Sacramento, and we have a small percentage relative to Los Angeles County and Southern California as a whole. Next. Here are the 10 essential benefits. All plans, whether it's bronze, silver, gold, platinum, have to have these 10 essential benefits. Having said that, if you are mentoring a patient or a potential patient about this who has very specific healthcare needs, they really should try and drill down to make sure that whatever medications they're on or whatever services they're on are covered specifically by their health plan. For example, I do HIV care, and I've gone to a couple of the forums specifically with Covered California and the health plans, and it has become very clear that all of the most the newest HIV medicines will not be covered on all of the plans. And we've had conversations about the rehabilitation and habilitation services also, all of them are not covered on all plans. So again, if you have a young, healthy person without any medical problems, just knowing these 10 essentials are covered is probably good enough. If you have someone who has very specific healthcare needs, they really should try and drill down to make sure what they need is covered in whichever plan they choose. Next. This slide is just to give you an idea of bronze, silver, gold, platinum plans. Again, all of them have to have those 10 minimum essentials. One can put icing on top of the cake if they so choose to entice you to get the gold or the platinum, but all have the 10 minimum. The thing that you should be aware of is that the plan that may look the cheapest up front, i.e. the bronze, because it has the lowest monthly premiums, actually may cost the patient the most, because if they actually utilize their insurance, the expected total out-of-pocket cost for the patient is about 40%. And as you can see, the silver is 30, gold 20, platinum 10. And I think patients have actually saw through this. Of all the people who have signed up so far, 61% have signed up for silver, only 23.3% have signed up for bronze, and trickling of people have signed up for the gold or the platinum. Next, please. Here, I really want to press upon you that there's really only one official website for Covered California, and definitely only one website where a person can actually enroll, and it's CoveredCA.com. There are many websites with very similar names that literally are out there to deceive patients or to strongly discourage patients from signing up for Covered California. So if one of your patients says, well, I went on the Covered California website and got nowhere or was told this was a horrible idea, first place to start is, did they actually go on the correct website? Next. At this point, I'm ready to actually jump into how to enroll. Do we have any questions about just the generals that we just discussed? Cynthia, do you have anything for me to address at this point?
Darin, there haven't been any questions written into the chat box. And,
okay.
So let's just continue.
We'll keep on moving. So if you were to sign on to CoveredCalifornia.com, this is what you would see. And I'm going to walk you through the different parts, but before we move anywhere, as you can see across the top, About Us Coverage Resources, that is exactly that, a lot of different resources for you to actually get information or your patients to get information. And we'll talk about ones that I think are important. In the center where it says Apply Now, Account Login, that is where a person would go if they're ready to actually enroll. And we'll do that step next. And then lower centered is Shop and Compare Tool, and we'll come back to that at the end. And this is if a person just sort of wants to know what they might be qualified for, but don't really want to go through the whole application process. That is a very good place for a person to start. And then on your bottom right corner where it says Key Deadlines and Dates, that is basically to remind you of sort of, if you want insurance to start at the first of the month, you need to enroll by the 15th of the previous month and when you need to make your payment by. Next slide, please. So again, this is the bar at the top that is a wealth of information. Next. This is under the News Center, and by the way, a lot of the numbers and facts that I've been reporting out as we've been going along, you would be able to find under this section. We had talked about our enrollment of the Latino population is underperforming, so this article here is specifically talking about strategies to actually improve that. Again, if you want up-to-date information on how many people have signed up, what the demographics are, where the challenges are, this is a very good place to get that information. Next. This is under languages, and it gives you the languages that we have information in. You should be able to click on it. Unfortunately, the only language I speak and read is English, but you should be able to click on each of these and find fact sheets and information in that language. Next. So if we were to click on English fact sheets, these are some examples of information that would be available to you. Next. And if you were to click on the Spanish one and go into the fact sheets, these are the ones that will be available to you. I'm assuming they're very, very similar to the ones that were available in English. Next. The website actually to enroll is available in English, obviously, and in Spanish. The other languages I know you can get information in, but I do not believe you can, from beginning to end, actually enroll in those other languages, at least not at this point. And this is just an example of the Spanish portal if you wanted to enroll. Next. Now, to apply. We're going to go in and look at some of the information that a patient would need to apply and some things that I think you should be aware of. Next. So the person who's applying is going to need to know, obviously, the number of people in the household, the age of the people, the household income, and they're also going to need to be able to break it down, just as you would do in your adjusted income on your taxes. How much is from employment, how much is from tips, how much is from alimony, etc. It will ask you for your Social Security in a couple different places. Some of them are not mandatory. There is one or two places where it's a hard stop. And if they don't have a Social Security number, it asks very tough questions for them to explain why they don't have a Social Security number. Zip code, because that actually helps determine how much you pay, is determined by where you live. Proof of income, I put optional here, because if you do not want any subsidies, you do not have to provide proof of income. However, if you're looking for subsidies, you need to provide proof of income. Next. Here, I just wanted to remind you and myself again that there are multiple ways for a patient to get help. And this is up in the right-hand corner on most slides. So if a patient were to get stuck, they can call the 1-800 number. They can go to a center. They can go in the chat. There's multiple different ways to get help if they're having difficulty navigating the system. Next. So when you're first signing up, there's a lot of things to read as always, and an electronic signature, and we'll go through that. One thing I will point out under username and password, definitely advise whomever you're talking to write this down, because you will need this information in a couple of different places. And a lot of layman people, their day-to-day lives, they don't create passwords. So they've got to create a somewhat sophisticated password, but they've also got to remember that. And being a physician, I actually went into the system, forgot my password, and had to go in and out multiple times to get it right. So from personal experience, write down whatever username and password, and there's a pen that they'll have to recreate. I encourage them to write those down somewhere. Next. Here is one of the screens where it's asking information. The red stars are required. Again, in this screen, the Social Security number is not required, but there will be some where it will be. Preferred method of communication, whatever they put, email, phone number, or address, needs to be verified, whichever one they choose. So if they put a false address in, the system will look for that address. If it does not exist, they've got a problem. It'll try and email you, so they put a wrong email in, they've got a problem. So whichever method they choose, that part of the application definitely needs to be accurate. Next. So at that point, what we've just done was actually create our login and account. So the next step is to actually go into the system, so account login. So again, just to make sure you understood, you were in one part of the portal where they were creating an account. And once you finish that, you come out of that, and now you go into a different part of the system where you actually log in, i.e., you need that username and password at this point. Next. Once you log in, depending on sort of what your role is, and you can see the screen for yourself, there's multiple different tabs you could pick. We are only going to talk about applying for coverage as an individual or applying for coverage for your family. Next. One really good thing that as you're doing this, it'll kind of check boxes, so you'll see sort of where you are in the process, and it actually gives you timers along the way, which you don't really see on this screen. Next. Actually, I'm going to back us up one more. I apologize. So here, again, in this screen, you would have had to put more information in about the household, personal data, the income, and eligibility. You would have actually needed to put a little bit more information in. Then you would have come back to the next screen. Next. Where you verify and basically electronically sign off. One of the things that I've been told by the people at Covered California that kind of catches people is this question, maintaining your verification. And it gives you options 1 through 5. Basically, what this question is saying is that whatever number you pick, that Covered California can just go and look for your taxes and whatever other information you use to verify behind the scenes for that number of years without you, the individual, having to resubmit it. So at least in my opinion, 5 years, which is the maximum, makes the most sense unless you want to have to be on the portal filling out this application year after year after year. But that's what that question is about. Next. The next thing in the portal is where you actually would select your insurance. And instead of actually doing that, I'm going to take us out and go into the Shop and Compare tool. One thing I am going to say, though, is that if you stayed in the portal and actually picked your insurance, there is one area where the patient, if they are wedded to a physician or have heard about a physician that they would like to enroll with, where they can put that physician's name in, and the system will tell you which plans they are or are not associated with if the patient chooses to do that. So now next, so I've come out of the actual application process because I just want to show you a different area, and this is Shop and Compare, which is circular. It would look very similar in the application process, except for you would actually pick the insurance. Here, the reason why I wanted to point this out to you is you don't need any proof of anything to do the Shop and Compare, but you can get a very good idea of what you qualify for. So if you have a patient that's just sort of thinking about it, just wants a general idea of what kind of subsidies they would get, which plans are offered to them but are not ready to commit, the Shop and Compare tool is a very good place to encourage them to start. Let's go into Shop and Compare, please. So this is the first thing that comes up, basically telling you which browsers will work. Next. So in this system, again, you need the number in the household. You need the age of everyone 18 years and over. You need the household income in general, and you need the zip code. You need no proof of anything is requested. Next. And here we're just giving you an example. We put in a household of 4 people, income of $55,000. You can read the zip code for yourself. You can read the age of everyone over 18 for yourself, and then you just click 2 people are minors. Next. This screen actually allows you to actually look at if this person was to do a bronze plan, a silver, a gold, or a platinum, sort of what that cost would look like to the individual. If you read the verbiage above it, it is clearly trying to encourage the person to think about silver plans, again, because the overall cost, if you use your health insurance, will be less if you use the silver plan. But here it gives the person a general idea of cost. One thing I really do want to point out under the bronze plan, again, if you have a young healthy person, this may work wonderfully. If you have a person with a chronic medical condition that will require seeing a physician regularly, you should note that only 3 primary care visits are covered under this plan, and you should note the significant deductible in potentially trying to educate a potential enrollee. Next. The person, just in our hypothetical, chose silver. And these are the 4 plans that are available to this person in the area, the zip code that they live in. So just a little bit more facts. Of all the health plans in California, only 12 of the plans chose to participate in Covered California. Of those 12 plans, which of the 19 different geographical areas that California has been broken up into vary. So if you were to look at Sacramento, you would see relatively fewer plans participating versus if you were to look in LA, San Diego area. So for this person's zip code, these are the 4 options. Also of note, and I have no idea why, of all the people who have enrolled, 96% have chosen 4 out of the 12 plans. Again, I have no idea why. Those 4 are Anthem Blue Cross, Blue Shield, Kaiser Permanente, and HealthNet. The other thing that I want to sort of bring your attention to, and if you could put the cursor over it, it says monthly premium assistance. You see $367. No matter which plan this individual chooses, that's the assistance they will get, $367. Having said that, each plan costs a different amount, so their monthly premium will be different based on which one they choose. Next. So that pretty much is the nuts and bolts. Actually, go back. Again, if you have a patient with significant medical problems, and let's just say, and I'm just being hypothetical, they picked, and I don't even CCHP because they like the price of that one. It happens to be the least expensive on this page. I would strongly encourage that they view the details to make sure whatever medicines they're used to taking are covered, or whatever sort of rehabilitation or habilitation sort of things that they're used to receiving are covered or might need to receive in the future. Keep going. So that's pretty much the nuts and bolts of figuring out which plan would be best for the individual, and they would actually enroll in it, and their information will be sent off. We're going back to resources. So if you remember on the very front home page across the top, resources was one of the tabs you could push. And if you were to push this, these are some of the important resources and fact sheets that you would be able to find. Next. I put this slide in just to really try and make it very simple as to who might qualify for what. So, path 1, if a person's income is below 138% of poverty, they most likely would qualify for Medi-Cal. Path 2, if a person's income is somewhere in between the 139 and 250 of federal poverty level, they will definitely qualify for premium assistance and most likely would qualify for assistance at point of service, assuming they pick a silver plan, which is the only plans that give assistance at point of service. If their income is above the 250 but still below the 400, most likely will still qualify for premium assistance but may not qualify for point of service. And then last, group 3, people over the 400% of poverty are welcome to get insurance through Covered California, but most likely will not qualify for any type of assistance. Next. This slide, again, is to drill home. There are multiple ways to contact Covered California and to get enrolled. And again, to really press upon you, there's many lookalike websites out there, but CoveredCA.com is the only official website, and it is definitely the only website that a person can actually enroll. But as stated earlier, they can call 1-800. They can talk to an enrollment counselor, which many have been chosen specifically to be culturally sensitive and for their linguistic skills. So again, depending on the individual, that might be quite helpful. And the counselor can actually move them on to an insurance agent, or they actually can go into a local county or human resources center and sign up. Next. If any of your patients come to you with concerns about Covered California, or you have any concerns as an agent of your patients, these are the websites and phone numbers that you can contact the various agents that should have purview over the issues at hand. Next. And then this slide is wanted to say thank you. We're coming to an end here, and to remind you of our next webinar that we will be giving. It'll be on February 12th, 12:30 again. And to enroll, you can see the enrollment information there. I also want to take this opportunity once again for anyone who was not on the call early on, that if you are interested in having this presentation or another presentation that covers Covered California and how to better educate patients around Covered California, our 4 organizations will be glad to work with you on trying to make that happen. Next.